Hi, I'm Dr. Alex Ye, and today we'll be checking out a live surgery involving a crestal approach sinus lift and the placement of 2 implants on a patient who happens to be my dad. So right now we're reviewing the CBCT and getting set up for the procedure. That's my dad. That's Dominic, and that's myself. We're just gowning up. Whenever we do surgical procedures, we use sterile surgical gloves as opposed to the procedural gloves for regular dental procedures. Just applying some topical anesthetic on my dad. A slow infiltration injection on the buccal side. And then later we'll do the palatal. That's the palatal. So we get started with the flap. So use the number 15 blade, and I'll make an incision along the alveolar ridge. Release the flap and expose the bone. For this surgery, we do not have a surgical stent, so I'll just be freehanding the placement of 2 implants. Prior to that, we'll lift the sinus and graft some bone into the sinus as well. So right now we're just starting out with the osteotomy. We'll be using the crestal approach sinus lift technique. So right now we're just measuring and making sure we're to the floor of the sinus. So we already pre-measured the distance, the thickness of the bone. And so we're just always double checking, so we minimize the risk of perforating the membrane, the sinus membrane. The goal is to perforate the floor and not the membrane. So we've started the 2 osteotomy sites. These drills, this set of drills has got a stopper, which will prevent me from drilling too deep. It also is internally irrigated and rounded at the end. It's designed to drill through the floor, the sinus floor, and the irrigation, the saline irrigation that comes out of the end of the drill, which tends to lift the membrane once the floor is perforated, which minimizes the likelihood of perforating the membrane. The problem I find with these drills is that so now I'm using the regular osteotomy drills, the twist drills from Nobel. The problem with the sinus lift drills from the crestal approach kit is that they cut quite slowly, and the floor of the sinus is cortical bone, which is quite dense. So we're still finalizing the osteotomy preparation. Now I'm going to the second site. So I've confirmed that we've perforated the floor of the membrane and not the floor of the sinus and not the membrane. And next is the hydraulic lift, which you just saw. The hydraulic lift helps lift the membrane Right now we're just packing the bone into the osteotomy site. Again, I like to make sure the graft is relatively dense, and from time to time the bone particles get jammed up in the osteotomy site, so I'll use an instrument to kind of loosen that up. So now we're placing the implant in the osteotomy site. I prefer, in a lot of cases, to just hand torque it with the manual torque wrench rather than the handpiece, the electric handpiece. Have a little bit more control, and you get a little more feel for the bone. So here I can slow things down, untorque it, and then torque it again. So this is the second implant going in, and I always like to check the torque levels. I believe we're achieving between 30 and 50 Newton centimeters there. So you'll see me torquing and then untorquing right at the end, so that I don't over-compress the bone, which can lead to pressure necrosis, and we would like to avoid that. And now I'm going to be placing the healing abutments on both of our implants. So these two implants will eventually be restored with crowns, which will give my dad back his posterior molars in the second quadrant. Right now he just has premolars. He's lost his 2.6 and 2.7 teeth. He also is missing molars on the first quadrant, which we'll do it on a different day. All in all, the procedure went quite well. It was pretty smooth. After we're done suturing, we'll take a final CBCT, and then we'll get him back in for a post-op check. This is dexamethasone. I routinely inject about 0.5 to a full cc of dexamethasone for most of my surgery patients. I find that it reduces the inflammation, and people generally have fewer post-operative symptoms. Very few of my patients end up taking any painkillers after the surgical date. So that's the CBCT we're taking, and those are the implants. All in all, the procedure went quite well.
So hopefully you enjoyed that video. If you have any questions, you can contact us at smilesdentalgroup.com, where you'll also find our phone numbers to clinics that might be near you. And remember, all of our consultations are free regarding implants or implant surgery. So if you have an interest in general dental procedures, please like our video and share with your friends.